Thank you, Mr. John Doe, for meeting with me this afternoon. I appreciate the time. Today, I just wanted to go over a couple of things specifically regarding your sexual health. In our last meeting, you had expressed to me the fact that while you do not identify as a gay man, you are a man who has sex with other men. So I wanted to go over specifically your health as it relates to HIV. One of the single most important things that anyone really who is sexually active, but specifically men who have sex with men, as that is the highest um, percentage of population that is exposed to HIV, is knowing your own status and knowing the status of an individual. Once you know your status, you then know and understand what are appropriate methods for either preventing future exposure or living with current HIV. So I wanted to just go over some terms, some terminology, and hopefully alleviate any of those questions that you had last time. When an individual is HIV negative, that means that they do not have the HIV virus in their blood count at all. It can take, you know, 2 to 3 weeks for it to show up in someone's blood. And so, oftentimes, when you do engage in unprotected sex, you won't know right away what your status is. It's important to be checked often, and that is just part of the kind of part of the regimen of knowing your status. So if you are HIV negative, and you are not, ideally it's always to use condom as a preventative measure, but that's obviously great in theory and not always what happens in practice. And if that's not happening, um, then the next best recommendation is to go on a prophylactic. And the most popular is called PrEP, which is also called Truvada. And that, if taken daily, it's a daily medication. It has to be through a doctor prescribed. But if that taken daily is 99% effective in preventing HIV exposure. If one is HIV positive, then they can go on what's called a cocktail of antiretrovirals. And nowadays, antiretrovirals have become so effective that it's really not typical to be on a cocktail anymore. Oftentimes, individuals need just one oral medication taken daily. And if that is done consistently, then the HIV virus, while is um, is there in the blood, it's you're considered HIV positive but undetectable. And what that means is the viral count is so low that if that individual engages in unprotected sex, they will not, it's statistically impossible for that individual to pass on the HIV virus. So, two different things here. Um, you can take a prophylactic PrEP to prevent the exposure of HIV. And you can, if HIV positive, you can take an antiretroviral that uh, very much diminishes your viral load. And these are both extraordinarily effective ways in living as a man who has sex with men and engaging in sexual practices that are potentially unprotected. So my recommendation to you, because I'm not your GP, I would recommend that you do get your blood work done. You find out what your status is, and then from there, discuss with your physician what the next best steps are for you personally as it relates to your sexual health. And of course, I'm here if you have any other questions. any other concerns that you might have. And if I don't know the answer, I will certainly either try to find it or connect you with somebody who does have those.